Dr. Donald Abrams, as you know from his bio online, has a very distinguished career. Probably the most highlights for us are that formerly chief of the hematology oncology at Zuckerberg San Francisco General, 2003 to 2017, and integrative oncologist with the UCF Osher Center for Integrative Medicine, Professor Emeritus of Medicine at the University of California, San Francisco. Dr. Abrams has done and been involved with a lot of clinical trials looking at both conventional and complementary integrative modalities, and co-authored the textbook on integrative oncology with Dr. Andrew Weil. Dr. Abrams, thank you for being with us.
Thank you.
It's the big button.
Yeah.
That's the one that's on.
Yep. Thank you. It's a pleasure to be here. Thank you, Amy, for inviting me. What I would like to do today is sort of give you my trajectory of how I landed at being an integrative oncologist. I do have some disclosures. None of them are particularly relevant to what I'm going to discuss. So my learning objectives are here. What I want to do is really tell you my story. I was born in New York, and for some reason we moved to Cleveland, Ohio. Which slide is up now? We moved to Cleveland, and I went to Brown University. And I was accepted at Brown into their 6-year Master of Medical Science program. The attractiveness of the program was that you could integrate liberal arts into your first 2 years of medical school, and then afterwards you went to Harvard to do your clinical work. I went to my 50th reunion recently, and that was my dorm room as a freshman. So I was in the 6-year Master of Medical Science program, but in my third year, I went to Amsterdam, and I was a hemodialysis nurse at St. Lucas Ziekenhuis in Amsterdam in the early 70s. And so you can imagine I spent a little bit of time at Club Paradiso down there in the left, which was a cannabis place. And at the end of my 2-month stint in Amsterdam, some of my high school friends and some of my college friends and I took a VW bus, and we drove from Amsterdam to Athens and back. And that gave me a little bit of pause. Do I really want to stay in Providence, Rhode Island for the rest of my training? As it happened, Brown decided that they were going to give their first MD degree in 150 years to my class. So instead of going to Harvard for the last 2 years, you were going to stay at Brown. And I said, you know what? I'm going to leave. Unfortunately, I was at Brown during Ira Magaziner's reign. Ira was in the Clinton administration, and he did away with all of our grades. So they told me, well, good luck getting into medical school. But I did. I got into Stanford. I can't complain. So I traveled across the country and repositioned myself for the first time in my life in California, and obviously I never left. Stanford encouraged people to stay longer than the traditional 4 years. And in fact, I got a 4-year scholarship after my first year. So I did another wanderlust, and I spent a year in London. When I went to London, I wanted to be a psychiatrist. I did before I went to London, a little stint at the Maudsley Hospital in Boston, Harvard's Psychiatric Institute, and I was more accepted by the patients on the borderline ward than I was by the staff. So I said, I don't know. And then when I got to the Maudsley Hospital in London, it was really bizarre, because what we called depressed, they called schizophrenic, and what we called schizophrenic, they said was a situational adjustment reaction. So I said, I don't know. And so I did, Roger Bannister, one of the first people to break a 4-minute mile, was my attending at Queen Square, where I did neurology after psychiatry. And I also worked at the Hammersmith Hospital, where I ran into some incredible hematologists who probably shaped my career to some extent. At the bottom right-hand corner is a picture of the Royal London Homeopathic College. And this is my first evidence that I was interested in something other, because I noticed that they had an 8-week program at the Royal College of Homeopathy that I really wanted to do, instead of doing pediatric neurology, which I had signed up for when I thought I'd be a psychiatrist. So I asked Stanford, is it okay if I do 8 weeks at the Royal College of Homeopathy? And they said no. So when I got back to California, I traveled with Rami, who was an Israeli ballet dancer who became my partner for the next 5 or 6 years. And I was going to do my last year at Stanford, but when we went to Palo Alto, Rami said, I can't live here after living in Tel Aviv and London. So we moved to San Francisco, and I did my senior year rotations at UCSF hospitals to the point where Stanford said, well, we don't really know you anymore. You haven't been here since your 3rd year, so we don't know if we can get you into an internship. So it turned out that I did my internship and residency at the Kaiser Foundation Hospital in San Francisco, starting in 1977. And what I saw a lot were gay men with diarrhea. And when we sampled their stool, they didn't have any pathogenic amoeba, but they had a lot of different parasites. So I said, well, we should treat this. And they said, no, they're not pathogenic. And I said, well, let's try it. So we did treat these people, and they got better. We called it the gay bowel syndrome, and it was antecedent to the appearance of diffuse lymphadenopathy. So I was working with Lee Wilkinson, may he rest in peace, on top there, who was the hematologist at Kaiser. And he was being referred many young gay men with swollen glands. And I was working in his clinic, so he said, Duck, because he called me Duck, Donald Duck, you're right. These are your friends, figure out what's going on. So my impression after talking to them and doing lymph node biopsies, which just demonstrated this benign reactive hyperplasia and no lymphoma, was that they were living in the fast lane too much. This was gay liberation. They were having too many sexual partners, too many sexually transmitted diseases, and using too many substances. So I said, why don't you move out of the fast lane and see if your lymph nodes disappear? They didn't. This again was 1979. When I finished my residency, I really wanted to stay at Kaiser. I loved it, and I'm actually a Kaiser patient now. And Jeffrey Fessel, the chief of medicine, when I went and told him that I wanted to stay, he said, we don't bring to the program people who can't give to the program more than the program gave to you, i.e. go out and do a fellowship. So Lee Wilkinson recommended me for a hematology oncology fellowship at UCSF. And I did that. I started my first year doing my fellowship at UCSF. And for the second year, I was going to start my second year. They did not yet do bone marrow transplants at UCSF. And they thought I would be a good candidate to go learn how to do bone marrow transplants at the Fred Hutchinson Cancer Center in Seattle. So they sent me for a month to Seattle. And on my way to the airport, I heard on the radio something about an epidemic of cancer in gay men. So as soon as I got to Seattle, I sort of outed myself, asking everybody if they'd heard about this epidemic of cancer in gay men, and nobody had. But shortly thereafter, it was reported in the MMWR from the CDC about the cluster of Kaposi's sarcoma. Interestingly, I worked with Don Thomas as my attending in Seattle, and he ultimately went on to get a Nobel Prize. When I came back from Seattle, UCSF Hematology Oncology Fellowship likes you to do laboratory work, and I didn't really want to. But in my first year, I had a young woman die of a very bizarre megakaryoblast leukemia. And after she died, her father, who was in the military, came and told me he had an erythroblastic leukemia. And I said, gee, this must be either exposure to a toxin or a virally induced malignancy. So that started me having conversations with Harold Varmus. Harold Varmus also won the Nobel Prize for his work in retrovirology. So it became evident that if I was going to work in a lab, I was going to work with Harold Varmus. And so here I was, a young gay man, and at the start of the gay cancer epidemic, as it was called then, working in a retrovirology lab. But I was a total klutz. I could not make RNA, and I couldn't do anything in the lab. And I kept trying to get the 32 postdocs in the lab interested in looking in tissues that I was collecting from these gay men with enlarged lymph nodes to see if there was presence of a retrovirus. everybody said, oh, don't be silly, there's no such thing as a human retroviral disease. So I got really frustrated and I left the lab because I could not make RNA and there was nothing else I could do there. And so I landed at San Francisco General Hospital before the Zuckerberg was attached to it. And I was working with Paul Volberding, who was the chief of oncology, and Connie Wofsy, an infectious disease consultant, may she rest in peace. And Paul was in charge of the malignancies associated with this new disease, and Connie, the infectious disease person, was in charge of the infections. And I was in charge of everything that was called ARC, for those of you that remember, the AIDS-related complex. So the lymphadenopathy syndrome and also immune thrombocytopenic purpura. And I was seeing lots of gay men with that hematologic disorder. Working on the front lines at San Francisco General was quite traumatic because oftentimes patients' families would come to San Francisco, and for the first time they would learn that your son is gay, your son has AIDS, and your son is dying. So it was an intense time. And those of you that were here then remember that we had bathhouses, gay bathhouses that were open, and it was felt that these might be places where this disease was spread. This caused a lot of trauma in the gay community because it was felt that closing the bathhouses would be against civil liberties and personal freedoms. And so, you know, there was the first year that Merv Silverman, the director of public health, called together a group of us. I was against closing the baths. But the more and more that I saw these patients with lymphadenopathy in my clinic, and I said, when did this develop? They said, well, I went to the baths, and 2 weeks later, my lymph nodes got swollen. So the next year, I actually stood behind Merv. That's me right over his head with the mustache. And I supported closing the bathhouses, which was, you know, caused a lot of trauma in the community. So one Sunday afternoon, I was invited to be on a KCBS talk show with David Eisenberg, who was an oncologist in Marin. And I had just gotten a call that week from Jim Geddert. I sent many of the samples of plasma from my patients with lymphadenopathy to Gallo's lab at the National Institute. And Jim Geddert called me and he told me, I have important news. There's going to be an announcement in the next 2 weeks by Margaret Heckler, the Secretary of Health, Education, and Welfare, that we found the virus. And we found it in 31 of the 32 samples you sent us. And it's a retrovirus. So here I was on Peter Eisenberg's talk show, and I knew he had just broken up with his girlfriend, Betsy Rosenberg, the week before, and I didn't think he was listening to anything I said. And then we got to people calling in, and a woman said, my husband has to have a hip replacement, and I'm nervous about him getting blood. And I said, well, I think we won't have to worry about that too much any longer because I think the agent responsible for this disease is soon to be announced. And Peter Eisenberg woke up and said, is that a scoop? And I said, no, forget it. And I walked out at the end of the interview, and Cindy Louie came up to me in a Snoopy t-shirt, held a microphone under my face and said, would you repeat that, what you said about an agent? And I said, what do you mean? She said, is that a bacteria? And I said, well, it can be, but in this case it isn't, it's a virus. And she said, what kind of virus? And I said, a special kind of virus called a retrovirus. And I didn't realize this is KCBS. So I went home, and in the morning I was awakened by a phone call from Fort Lauderdale by a reporter who said, is this Dr. Abrams? I said, yes. He said, is this the Dr. Abrams who's announcing the discovery of the AIDS virus? And I said, I hung up. And it was very early in the morning, 3 hours different. And then my cousin Marcia called me from New Jersey. Mazel tov, I just heard you on CBS announcing the discovery of the AIDS virus. I said, oh my God. So when I got back to work, I said, if anybody calls, no comment. The National Cancer Institute wanted me to withdraw the announcement or to say that they were lying. And in fact, ultimately, Margaret Heckler had to make the announcement a week earlier because of my big mouth. But I did get some notoriety. Did have a walk-in role in Bohemian Rhapsody, if you recognize me in the white coat on top and behind the patient on the bottom. So 1985, Mayor Feinstein invited Paul Volberding to a meeting so he could meet with AIDS doctors in San Francisco so that the San Francisco General Hospital did not become like an AIDS hospital only because we were a teaching hospital and that wouldn't be good for education. So Paul said, these are all your friends from the gay doctor group, why don't you take it over? And what I did was we started an educational group that met monthly in all the hospitals around the Bay Area. And then I would tell them about the research we were doing at San Francisco General, and they said, we could do research too. So we developed the County Community Consortium, which is a practice-based research network of individuals in the community that were caring for people with HIV. And in addition to enrolling patients on clinical trials, it also gave my colleagues in the community an opportunity to, number one, get together on a monthly basis, and number two, feel that they were doing something other than just having young gay men die in their practices, which is not what they were preparing for when they went into family practice or general internal medicine. Originally, we were funded by the American Foundation for AIDS Research, but subsequently, the National Institutes of Allergy and Infectious Disease funded us for many, many years, millions and millions of dollars. In 1986, AZT was approved, and this was not something that I was very fond of. I said, this is not a very good drug. And so I was not a proponent of AZT, and I continued to study other alternatives, which if you think about it, this was also an evidence that I was interested in other therapies. So dextran sulfate, for example, something that I studied with Japanese colleagues, was an article that we did publish, and we tried to do it as an NIH study. The Community Consortium did a study of inhaled pentamidine that worked to decrease the risk of pneumocystis pneumonia and led to a New England Journal of Medicine article. The community programs for clinical research on AIDS that the Community Consortium became part of has been a very successful, or had been a very successful organization, and I was one of the leaders of that. And that organization expanded into an international research group called ESPRIT. And I surprised Jim Neaton in the middle of that picture at his retirement 2 years ago, and standing on the other side is Cliff Lane, Tony Fauci's right-hand man. So I did a lot of research, as mentioned, in conventional medicine. But during that time, we were young doctors dealing with young people very similar to ourselves dying. And there was a demand for assistance. After a few years, when people realized what the death from this terminal illness was like, they said, I don't want to do that. So we did a survey of our community consortium providers. We gave them a case and said, would you assist this person in taking their life? And we found not only did the majority of people say they would, but we asked them, have you ever? And 53% had. So that led to an article in the New England Journal, and Roz Leiser, one of my nurses, also surveyed nurses and found a similar proportion were interested in assisting. And ultimately, it took a number of years, but as you all know, we have this option now in California, so we're quite happy with that. But I continued to be interested in other than conventional interventions. So DHEA, which is like a testosterone equivalent that actually unfortunately becomes estrogen, was something that we looked at, looking to see if it had any effect on HIV. And distant healing, another thing that I was interested in, we also studied. But I also have always been interested in traditional Chinese medicine. I sometimes think I was a practitioner in a former life, and I worked with Misha Cohen in San Francisco to do a number of studies of traditional Chinese medicine interventions. But it was really cannabis that took me to integrative health. Brownie Mary, otherwise known as Mary Rathbun, was a woman in her 60s or 70s who lost her only daughter to an automobile accident and became very anti-alcohol, but very pro-cannabis. And the International AIDS Conference in 1992 was held in Amsterdam, of all places. And I was glancing down at CNN headline news, and I saw Mary Rathbun being arrested for baking brownies in Sonoma. Mary would, volunteer of the year for 2 years running at San Francisco General. She would take our patients to x-ray and drop off their prescriptions in the pharmacy, and she would also provide them with brownies, marijuana brownies. So I saw her being arrested, and when I got home from San Francisco, there was a letter sent to the director of research in the AIDS program, which I was not, by Rick Doblin, a PhD from the Harvard School of Government, who founded the Multidisciplinary Association for Psychedelic Studies, or MAPS. And the letter suggested that a study showing the therapeutic benefit of cannabis should come from Brownie Mary's institution, as if she were our dean. Well, the letter got to Mark Jacobson's desk, and Mark brought it to my office one morning and said, "Hey, Donald, the community consortium should be interested in doing this work to study marijuana in patients with the AIDS wasting syndrome." And I said, okay. I picked up the gauntlet, and I started communicating with Rick Doblin. Ultimately, Eric Gooseby, who worked in the Clinton administration as well, warned me that I shouldn't do this, that it would be damaging to my career to try to study marijuana. At about the same time, Clint Werner came into my life. Clint, now my partner of 30 years, when I started bragging about how many United miles I had, said, "Hey, how would you like to go see a total eclipse of the sun in the Atacama Desert of Chile?" So I said, okay. I took him up on it. So in 1994, we went to the Atacama Desert, and I saw my first total solar eclipse, nature's greatest spectacle, like looking into the eye of God. We just celebrated our 30th anniversary of chasing eclipses together in Cleveland, which is where I grew up, with 50 friends and relatives at the Ritz-Carlton, and we saw a perfect total eclipse. But Clint said, hell no, you're going to do this study. Clint wrote the book, Marijuana Gateway to Health, How Cannabis Protects Us from Cancer and Alzheimer's. So he said, you have to do the study. So first I proposed a 4-arm comparative outpatient evaluation of 3 different strengths of inhaled marijuana versus delta-9 THC or dronabinol. And NIDA said, no, this is not scientific. So Rick Doblin's group demonstrated in front of Alan Leshner, the head of NIDA, saying that they were blocking research into marijuana. And Leshner told them that if Abrams submitted a study that was favorably peer-reviewed, that they would consider giving me the marijuana. So what does that mean? Submit it to the federal government as a grant. So we did submit in 1996 a very much more intensive, smaller study that was going to be done in our clinical research center at San Francisco General, very elegant, measuring everything possible. The study was not scored by the NIH committee. When you submit a grant to the government, half of them don't get scored and the other half get scored and ranked. Our reviewers cited the toxicity of marijuana and the concern that patients with the AIDS wasting syndrome inhaling cannabis might get atherosclerosis, which was not something that these patients needed to worry about. So then in 1996, California approved medical marijuana, as you recall, and also protease inhibitors became available as a standard of care. Protease inhibitors are metabolized by the liver, and we heard an excellent presentation on botanical pharmaceutical interactions, and so I took advantage of that. And I proposed to the government a 3-arm comparison of the impact of smoked or oral THC compared with THC placebo on the concentration of the protease inhibitors, the viral load, and the immune function. And that study, NIDA said yes. Clint calls it my Trojan horse because I was looking for damage or harm instead of for benefit, but we did look for benefit as well. So I got $1 million and 1,400 of NIDA's best cigarettes, and it gave me another chance to write an article, Medical Marijuana Tribulations and Trials, and it got me a cover boy of the Chronicle the month before 9/11. And ultimately, we published an article in the Annals of Internal Medicine on our findings. So in the year 2000, the Center for Medicinal Cannabis Research was established at the University of California for the purpose of funding studies to look at the health benefits of cannabis. And in that year, 2000, I received grants to do 2 studies. One looking at the effect of marijuana on neuropathic pain in HIV patients, and the other looking at marijuana in combination with opioids for cancer pain. Both of these were set up as pilot studies, enrolling 16 people to see if there was a benefit, and then after that, if there was a benefit, to calculate the sample size for a follow-on randomized placebo-controlled trial. So the HIV neuropathy studies rapidly enrolled 16 participants, and 17 of the 50 enrolled in a follow-up randomized controlled trial. At the time, the same time I started the cancer pain study, only 3 people had enrolled. So we changed the design to include patients with any cancer and any pain. Originally, it was breast and prostate cancer with bone pain from bone mets. But ultimately, I couldn't enroll patients, so I lost funding for that study, although we were successful in publishing the paper on neuropathy. Christine Majaskowski, who's a nurse working in symptom constellations, told me that cancer patients are not particularly interested in spending more time in the hospital because all of our marijuana studies were inpatient studies in our inpatient clinical research center. And then we also were doing an experimental pain model so that we can ask patients about their clinical pain as well as a pain that we induce. And the IRB thought it was not ethical to induce pain in cancer patients, although they didn't have a problem with that in HIV patients. And then patients with cancer in San Francisco have long access to cannabis and didn't need to participate in a clinical trial where they might get placebo. So despite the fact that I was unsuccessful in doing clinical trials, I have become sort of the expert on cannabinoids in cancer care. So how does that relate to integrative medicine? Well, in 2002, I did my first ever jury duty. And when I came home, I told Clint, I want to go to law school. Clint attended the Telluride Mushroom Festival for a number of years that I couldn't go to because at the time I was president of the Gay and Lesbian Medical Association, and they met the same time as the Telluride Mushroom Festival. But in 2002, I was done. I was the immediate past president, and I didn't need to go to the meeting. So I went with Clint to the Telluride Mushroom Festival, which is a beautiful locale, and it's there that I first met Andrew Weil, the father of integrative medicine. And Andy described a 2-year online distance learning fellowship he could do with his program in integrative medicine at the University of Arizona. So I said, I don't want to go to law school, I want to do that. I realized that I, at the time, was 52 years old, and I always loved being a student, and I was afraid that I wasn't going to be able to remember things for too much longer, so I just wanted to be a student. And I was, and I did the 2-year online distance learning program, and I graduated in 2004. And then I came home to San Francisco, and I said that I wanted to do integrative oncology. So I went to my friend Margaret Tempero, who at the time was the head of the Cancer Center, and I said, can I come to the Cancer Center and do an integrative oncology clinic? And Margaret started talking about revenue streams. And I worked at San Francisco General. I said, we don't even have a creek. I don't know what you're talking about, revenue streams. She said, why don't you go across the street? They just opened the new Center for Integrative Medicine across the street. So I went and I spoke to my old friend, Susan Folkman, who also used to be an AIDS-related person. And I said, would you mind if I just did a half-day clinic here? I just want to see if I like doing integrative oncology. I said, you don't have to pay me because I have a lot of grant funding. She said, sure, come on. So I did it. It quickly became my favorite half-day. And then I asked to do another half day, and my administrator at San Francisco General said, you have to get paid. You can't do 2 half days for free. So I did, and for a while I was the director of the clinic, but under my directorship, we transferred to being fee-for-service to taking insurance, which was not popular with my coworkers. So I was asked to step down in 2008, and I did, but I still work there. So what do I do in integrative oncology? When you hear the words, "you have cancer," your locus of control has been ripped from underneath you. And now you're at the mercy of the surgeon, the radiation oncologist, the medical oncologist, and even the chemotherapy nurse. So what I try to do in my visit is to restore to the person a sense of control. Inflammation, as we've heard throughout the day, is a major source of degenerative diseases of aging, dementia, heart disease, and cancer. So decreasing ongoing inflammation is another goal. And when you do that, you unleash the body's immune system in the fight against cancer. And as you know, immunotherapy is what we're really focusing on now, very similar in increasing the body's innate immunity. I used to ask all of my patients, "Tell me your story." And, we get these Press Ganey scores, and my lowest score was always, "Doctor knew my history." Well, I was asking, "Tell me your story," because I wanted to hear from the patient how that diagnosis of cancer impacted on their life. But now I sort of tell the patient their story so I get a better grade. And it turned out when I did ask to tell me your story, many people wove a story as if stress caused their cancer. Stress in and of itself does not cause cancer, but stress is not good for cancer or anything else. Stress is adrenaline or epinephrine, which kills lymphocytes, and cortisol, a steroid hormone, which is an immune suppressant. So decreasing stress is important. All of this serves to increase hope. Many patients leave my initial consultation saying, "Gee, Dr. Abrams, you're the first person that's given me any hope." And it's not like I've said you don't have cancer or you're not going to die. I've just given them things that they can do. And what are those things that they can do? Controlling their weight. Obesity is now responsible for anywhere from 10 to 40% of all cancer. And you do that by altering your diet and increasing physical activity. I discuss use of appropriate supplements. And the breath, as you know, is the link between the mind and the body. Because until I mentioned it, we were all breathing autonomically, but now we are aware that we can control the rate and the depth of our inspiration and expiration, and that is how to sort of decrease stress. If you need more, guided imagery or self-hypnosis. Nobody ever comes to see me by themselves. Cancer does not affect just an individual. It affects the family and the community. So I remind people to connect with their family and friends. I always ask at the end of my interview, were you raised with any religious beliefs? And most people were, but most people are lapsed. And then I say, do you consider yourself spiritual? And most people do, unless they're lawyers or engineers. And then I finally ask 3 closing questions. What brings you joy? What are your hopes? And where does your strength come from? And one husband said when I was asking his wife these questions, "What, is she being interviewed for Miss America?" But I saw a woman at a conference who told me that she brought her husband to see me when he was near death. And she said, but when you asked him those questions, he realized that even though he was where he was in his journey, he still had joy, hope, and strength. And that was very important. I tell my patients that cancer is like a weed, and someone else is taking care of their weed, and it's my job to work with the garden and make their soil as inhospitable as possible to growth and spread of the weed. So I do that by asking them how they fertilize their garden, that is, what they eat and what supplements they take. And I, for one, am a big fan of the American Institute for Cancer Research. Their recommendations for reducing the risk of cancer, but number 10 says for cancer survivors, follow the 9 guidelines above. And again, number 1 is be a healthy weight. Number 2, physically active. Number 3 is about sugar. Sugar does feed cancer, so we should avoid sugary drinks and sugar in general. Limit consumption of red and processed meats. In 2007, it said limit consumption of red meat and avoid processed meats, which is a better guideline because processed meats, bacon, salami, bologna, hot dog, sausage, anything you put on a pizza, are considered a class 1 carcinogen. No doubt about it by the World Health Organization. They shouted out fast food this time too and said avoid fast food. The positive recommendation is to eat a diet rich in whole grains, vegetables, fruits, and beans. By the way, those are all carbohydrates. not to disagree with the last speaker, but I disagree with the last speaker. Alcohol used to say, if consumed at all, limit to 2 a day for men and 1 for women. And as somebody who doesn't drink alcohol because I don't tolerate it, if at all 2 a day seem very dichotomous. They changed it now and it says for cancer prevention, it's best not to drink alcohol. We believe that 6% of all cancer is related to alcohol. The other question I'm often asked, and this is right what Dr. Chen spoke to us about so eloquently this morning, is can I take this? And really they're asking me 2 questions about these supplements. Is there any interaction between the botanical and the drugs? And most of these are going to be by way of cytochrome P450, 3A4. And we already heard about St. John's wort and what it does, and I think we really had a great presentation this morning on this issue. The other issue that's of concern to cancer patients is the antioxidant debate. Radiation therapy works by making free radicals of oxygen to knock into the tumor DNA and kill it. So do you want to be taking antioxidant supplements if you're getting radiation therapy? In addition, some chemotherapy also works by creating antioxidant free radicals to knock into the cancer. So my advice is really that it depends on the goal of treatment. If we're going to cure the patient, and we do cure many patients with cancer, or if the treatment is giving adjuvantly just to prevent recurrence, I say, why don't we hold off on antioxidant supplements until this is done? Eating antioxidant-rich foods is fine throughout, because when it comes down to that blueberry or that beam of radiation, there's not a real context here. If the goal is palliation, and if the patient feels they want to, again, empower themselves by taking some supplements, I'm not going to fight it. So I have always had a very busy clinic. And the wait to see me as a new patient is 3 months, 4 months. I schedule my own patients, and my next follow-up is in May. So that's not good if you have cancer. So in an effort to reach more people, I initiated a program of group medical visits, Introduction to Integrative Oncology. And we actually did research on that and the fact that it improved access to integrative oncology and that the patients in the group really enjoyed it almost as much as I did. So Julie Gerberding, my dear friend who ran the CDC under Bush II, currently head of the NIH Foundation, used to work at San Francisco General doing infection control, told me many years ago, you can't retire, you'll get bored and sick. And it sounds a bit like an old curse. So I did actually do it, and it was during the pandemic, June of 2020, and instead of having the party on top of the new hospital, we had an electronic tribute, and in the middle of it, my dear friend Tony Fauci called in to say a few words. So I actually retired in June of 2020, but UCSF allows you to retire and disappear for a month and then come back emeritus status as a recall. So take only pictures, leave only footprints. I wanted to leave some footprints. San Francisco General created a Compassion in Medicine Award in my honor, and UCSF Osher Center just inaugurated the first Donald I. Abrams Lectureship in Integrative Oncology lecture last Wednesday with Andy Weil coming. Yeah. So what am I doing during my retirement? I do my clinic or group visits Monday and Tuesday morning still at the Osher Center. Clint, my husband, is an only child, and even during COVID, he said, honey, 24/7 is not going to work. Get out of the house. So I'm happy to drive to the Osher Center, go to my office, and do my clinics Monday and Tuesday morning. I'm also faculty for an Integrative Medicine and Hematology Oncology Fellowship at the University of Arizona in collaboration with Mayo. I do some nonprofit advising, and I am the executive director of Andy Weil's Foundation, giving out $750,000 in grants to support integrative medicine education. And I also co-chair the Society for Integrative Oncology Council of Presidents. In my spare time, I really believe nature is important. So I spend a lot of time out there. During that month off, I try to take golf lessons from a semi-pro, but as you can see, my mates don't even like the way I play. I did learn how to show my dachshunds. We have 4, all descended from Ruby in the front here. And that was a short-lived career as well. So I spend a lot of my time reading, and I like to read mainly fiction. But I will point out 2 nonfiction books that were very powerful. The First Cell by Azra Raza, who's a myeloproliferative scientist, really talks about how we're doing it all wrong in trying to develop anti-cancer drug. Between Two Kingdoms, if you haven't read that, is an incredible story of a young woman diagnosed with acute myelogenous leukemia. She has I wept at the end of this book. Clint always is, why do you read these books if you're going to cry? Well, I think crying is a good thing, right? So with that, I will thank you for your attention. Wish you all a happy dinner.